gubernatorial election is fast approaching, but where do the candidates stand when it comes to the issues that matter to you most? I'm Lindsay Grom, and between now and the election, IPBS will take a closer look at Governor Mitch Daniels and Jill Long Thompson's plans for Hoosier healthcare, environment, education, and the economy. In this segment, healthcare, we take a look back at the major moves that have been made under the Daniels administration and what he and Jill Long Thompson say they plan to do next.
There's people out here that just can't afford it anymore.
Retired steelworker Steve Scavera knows a thing or two about unaffordable health care.
And, it soon became apparent that I wouldn't be able to afford to buy health care for my wife because of what mine was costing.
Suffering from a disability, Scavera remains on Medicare. But due to budget constraints, his wife has lived without health insurance for several years.
But if she had to go into the hospital, it's a nightmare. We'd probably lose the house. It's the only thing left.
Just like Scavera's wife, more than 400,000 Hoosiers are currently uninsured. But both gubernatorial candidates have different ideas to combat that problem. Jill Long Thompson wants to focus on small business employees.
We don't have a real pooling option for families and small businesses to purchase health insurance at rates that are comparable to what large corporations pay.
Mitch Daniels' Healthy Indiana plan pays closer attention to the working poor.
HIP, of course, is designed to go right at the problem that worries us the most, which is people who are of modest income and have no option today. And HIP can take care of about at least 1/3 of that group.
During the Daniels administration, HIP has insured almost 25,000 Hoosiers, a number legislators say falls short of where it should be.
Tacking on that 44 cents per pack of cigarettes, there was projected that we would generate enough revenue to cover 133,000 of the estimated 400,000 uninsured Hoosiers.
The lack of insurance isn't the only health crisis the Hoosier state is dealing with, as we also are ranked number 2 in the nation among states with the most smokers. And we're listed as the 11th fattest state, up from the number 10 spot last year.
We've been improving on those rankings, but not because we've gotten a lot better. It's just because other states are getting worse.
Both agree that preventative measures must be taken for the state to shape up. Long Thompson proposes providing tax incentives to businesses providing wellness and health programs for its employees.
We need to work to find better ways to make Hoosiers healthier.
But Daniels says even with successful programs like In Shape Indiana, the government can only do so much.
We'll be a whole lot more prosperous and successful state as Hoosiers being taken better care of themselves.
Scavera says he's been taking care of himself and his wife all along and believes it's going to take change to both state and federal health care regulation to turn his situation around.
Because there's a lot of people to do without until it's too late and they end up in the emergency room.
For Indiana Public Broadcasting, I'm Lindsay Grom in Indianapolis.